Hi, I'm Jonathan Wright, and thanks for having me at this NHS fundraiser. I'm going to be talking about my initial topic, which was around digital twins, and I'm also going to talk about a project that I'm working on with MIT on contact tracing. So something very relevant, and I know the NHS are working very hard to do the NHS X application to be able to do something very similar to what we're working on. So, as you saw from the background, I cover a lot of different technologies, and that was my TED talk, which I was in the background. And one of the areas that I talked about was digital twins. So it's also very linked to the topic we're doing, but I'm a digital therapist. I've been talking about digital for probably the last 10 years, and I'm going to talk to you about the technology and how you can get involved and how we're approaching the testing off this platform, which is hopefully going to be going live as we're talking right now. So what is a digital twin? Now, a digital twin is nothing new. It's been around for a very long time, and I'm going to give you a quick brief history of what a digital twin is. So actually, the easiest and probably the best example would be back in about 50 years ago, actually, when NASA helped Apollo 13 come back safely home. So what they did, and I know they're not using the HoloLens technology in the photo you see, but they built a replica of the Apollo 13, but also a digital copy of it, so they could look at how they could potentially simulate the real scenario, so that they could help them fix the problem and solve the challenge they were having. So, but more recently, Michael Greaves talked about using a digital twin as part of a product life cycle. So, actually as part of what we do for testing. So if you think of a Tesla, that's a great example of what will have a digital twin. There'll be a model of that, a simulation of that, which they can run through for all the autonomous computer vision that they do as part of the autonomous capability and the Car2X and Infrastructure 2X that we're seeing. So on the right hand side, we've got a great example there of a smart city, and I'm going to give you a bit of an example of where I've done contact tracing for a smart city project, and how that got me involved with the guys at MIT. So let's quickly talk about the MIT project. So I got involved with MIT a few weeks back, and this was due to my background in doing this for the Copenhagen Smart City project. There was a lot of similarities. So they asked me to help lead the QA for testing this system in production, and make sure that we're getting less false positives, and we build trust and transparency for people who are using it, just like the NHS X app, which will be launching next month. So let's just understand what it's there for. Well, it's a mobile app, so you'll be able to download this at the moment. So if you go on the App Store, you can download Privacy Kit or COVID Safe Paths, depending if they've renamed it in time. And then what you can do is you can start seeing if you've been exposed. So the way that is it's using your GPS history from things like Google location services to see where you've been over the last 14 days and whether or not you've actually interacted with somebody who has been diagnosed with the COVID-19. So I'm going to give you a bit more detail about how this works. So it's going to work at if you've cross paths on any of those days, and then send you an alert. So it's going to either be amber, depending on the level of accuracy, amber or red. So obviously, partly what we're doing here is we're looking for things like multimodal transportation signatures. So for instance, if I'm in a car and I'm driving and I go past a location where there's somebody else who's driving, then I don't need to worry. However, if I'm on public transport, so using the Google APIs and working quite closely with Google at the moment, we would look at it and go, okay, that person was traveling on a bus or a train, and therefore they could have been in the same location. Or even if you were just going out to get food and supplies, we'll be able to tell you that, because Google takes 650 locations by default. If you've got an Android device, 650 locations, which is a 5-minute polling. So every 5 minutes it understands where you are. So you can do that now. You can literally go into Google and see where you've been for the last 14 days, which, as we're all self-isolating, unless you're frontline staff for the NHS, for instance, you're not going to be collecting data. But historically, you'll have all your data from maybe the last 6-7 years as you've been using a smart device. So that's a really useful set of data that can help with this project, which I'll talk about a little bit later. But you might be kind of thinking about, well, if you've not got an understanding of what Test and Trace is all about, great website, just literally launched as I recorded this, called testandtrace.com. And there's this great example on it at the moment where it kind of says, okay, in the top section, you've got somebody who's got symptoms. So my uncle's been taken into intensive care this week, and he's now diagnosed with COVID. So part of that was if it was my uncle, Dennis, he would have got loaded the mobile app on his phone, checked if uploaded the data, so that he would have been interviewed by somebody, say for instance from the NHS, because he's in an NHS hospital at the moment, and they would have said, where have you been, Dennis? What locations have you been? So then he would then say, well, actually, I'm a part of the, key workers. So this is my transport to work. This is my transport, to get food. But obviously there's other people who've got the disease, who aren't already been hospitalized, who don't realize that they've got it, and potentially Dennis might have crossed paths with those and passed the COVID on to them, but they may or may not have got that to other people. So there's like this idea that we're kind of one step behind. And what we want to be able to do, and obviously this is really important from a false positive perspective, is we want to be able to notify people with confidence to say, yes, I interacted with somebody who had the COVID infection, and now I should self-isolate for the next 14 days. So that's kind of one of the things. I know the NHS X guys have been doing that an REF based by, setting up with the way that Google and Apple have been using the Bluetooth capabilities. So with the app, which I've got on me now, part of it is it would be sending that beacon data, those private over Bluetooth, to say what distance am I away from people. What we're using for the MIT project is we're using GPS information. So that's stuff which comes from your sensor data anywhere on your phone. So I think it's probably worth kind of explaining the two main use cases, because as you're self-isolating, and most of the people who'll be listening to this now are self-isolating, they'll want to understand whether or not they have interacted with somebody. So part of it will be to upload the app, and if I quickly navigate through, I can share my location data. So what I can do is I can click here, and I could upload this to my local health authority. So in this case, it'd be the NHS, but we're working with health authorities across the globe in lots of different countries to be able to select what your health authority is, and then be able to pass that information. And of course, once I've shared that information, that will then go into a database, which then can check whether or not anybody else has been who's crossed paths with anybody who's been infected. So that's the kind of the basic use case which we're trying to cover for somebody who's not infected. So that's the first scenario. But what happens if you are infected? And we've looked at the stats, and if you take South Korea as the best example, they were able to flatten the curve quite early on, and that's because they'd already experienced one of these outbreaks. So they were kind of prepared, and they'd already gone through something very similar. So patient 31 is kind of the first diagnosed patient which they had in South Korea, and they visited a hospital because they checked themselves in to say that they weren't feeling very well. And of course, at that point in time, the medical staff would say, okay, well, tell me, where you've been. And of course, that's fine. The person kind of said, well, yes, I've been to church, I've been to these public locations on these days at these times, and that's great because it's you're giving them a map of what you're doing. But that interview process can take quite a long time. So what we're trying to do is avoid that by creating this digital blueprint of exactly where you've been at what time. And we can then isolate those people who you've been in contact with. So in this case, over 1,000 people in South Korea. So part of it is how can we go through and trace that information of historical information and with a certain level of accuracy, and also identify who else could potentially be infected. So I guess the next example is potentially where this new technology, which both these slides are from Apple and Google, and they're working on this new Bluetooth capability. But part of that beacon data is they'll be able to send, when you get close to somebody, if say for instance I'm having a conversation with somebody at a certain distance, that API, which is going to be opened up by both of the phone devices, would be able to exchange that information anonymously and kind of say, okay, you interacted with somebody else. So this is kind of where we're wanting to go, and I know the NHSX is really trying to get this technology out there. So I'm going to go back to SafePaths because this is kind of what I'm really involved with on a day-to-day basis, and I've literally spent the last 4 or 5 days straight working silly hours, which is why I look probably quite tired. But part of it is we're all coming together. They're all volunteers, and we're all trying to work on getting this SafePaths app live. So I've got a team of 20 testers in Italy at the moment who are doing localization testing of the mobile app on the iOS version. We've been testing pretty heavily for the Android version over the last few weeks, and we're hoping that actually it will go live before at the end of April. So this is really quite exciting for us. So there's kind of two components to what we've got. We've got the SafePaths app, which is going to be where you're able to get the notifications. We've gone through that kind of scenario, but also we've got on the other side of it, we've got the Safe Places web tools. So this is a visualization tool which actually be able to model where you've been and also kind of understand, well, you were traveling at 3 miles per hour, so you were probably walking, or 12 you were on a bike or in a car or a public transport or a train or the underground, so you appeared at one location and then you got on the metro and you appeared somewhere else, which was one of the big challenges with the New York outbreak. Was really a lot of people still using the metro, holding on to the rails, a lot of transmission going through there. So these are what we're trying to do, is we're trying to understand the multimodal models and then but of course we need realistic data for that, and people aren't around, so we're having to do some really cool stuff, which is where the kind of the digital twin kind of comes into play. So I think I mentioned before that I'd done this for a previous project, which is kind of where my involvement kind of came in. So back in 2015, I was working with the city of Copenhagen to help people become more carbon neutral. So part of that was taking information, GPX information, so GPS location data, and understanding their route to work, and encourage them to use different types of modes of transport which had less of a carbon footprint. And as you could expect, this was a challenge and it's kind of what I'm doing now from a performance perspective for the COVID Safe Hands application. So, when we launched, we expected 38,000 people of the city of Copenhagen who worked or lived in Copenhagen to actually use the mobile app. But, we also tried to encourage people by introducing things like gamification. So an employee would, create a team, and then they would get tax rebates, or they'd get bikes, or they'd get, they'd encourage their staff to actually use the application and try and help with the carbon emissions. So we needed data. So I worked with a team, a good friend of mine, Hugh Price, who I actually did podcasts with, yesterday on Vivid Talks, which you can download off the Apple Store. And what we did is with his team is we took some deltas. So in this particular example, we used the students of Copenhagen to turn the GPX logger on their phone and just go around, going to lectures, going to cafes, going to and from their homes, and we got that information and they uploaded it, and then we used that delta to then generate 5 billion historical transactions, which was literally the last month of 38,000 people actually moving around the city of Copenhagen. So once we'd got that data, one of the things we needed to do was then inject it into the real devices. So you can see from this rolling demo back in 2015 that what we're doing is we're injecting the longitude and latitude of data that's been generated by this model, and the phones on the right hand side, which are real phones that are located in a rack in Copenhagen, provided by a good friend of mine, Iran's team at Perfecto Mobile, and you can see them moving around the city of Copenhagen, and that information then could be uploaded to the Smart City app, and then we could submit or publish that information. So very similar to the contact tracing that we're talking about today, and it really we're using some of the same kind of technology to make this possible, because as you can probably expect, we need to have a phone A, which is somebody going to, say, for instance, Starbucks, and a phone B for somebody who's also driving past Starbucks or on a bus past Starbucks, and then also a third phone which is actually coexisting in the same queue. And then we need to make sure that the second user gets an amber warning to say drove past somebody with it, but the person who actually on phone 3, who was coexisting at the same GPX locations or within a certain range, that actually they'll be read and they'll be flagged that potentially they could have got infected. So using this technology, we needed to do a lot of modeling different scenarios, because of course we needed to be able to test those kind of scenarios. So a scenario where there's an event going on, a meetup, or like this Silicon Brighton usually does. So we needed to be able to model all of those different scenarios. So this is really where the digital twin came in, because these kind of two things, and this is where I've been talking about for probably the last 5 or 6 years, is this idea of taking data from production, taking it from the real world. And I've been helping retailers and the government for Brexit to take what the model of a pre-Brexit looks like by taking a snapshot of production, and then taking that model and then looking what a post-Brexit would look like as far as a flow. So the behaviours would change, and we're doing the same thing now. We're helping the UK government with, their initiatives which they're doing to actually allow people who are unemployed or furloughed to kind of be able to submit and be able to get support. So part of it is the model changes and it evolves, and what we need to do is capture that model and then look at how we can actually change that digital twin. So again, another demo, 22nd of April, we can see here we've taken kind of 3 standard flows which I've just talked about, which was this idea of being able to be a user like my uncle who's got the unfortunately caught the COVID-19, and he wants to load up the application. He needs to go on and actually upload his data. So he's going to have to he's going to have to choose his health authority and pick a trusted partner to actually do that. And then the next step is that he's obviously going to have to share his data. Now we can share data in a number of ways, and as you'd expect, we're doing a privacy-first approach to this project, which means that people's data is incredibly important, and so therefore it has to be secure. So the first step would be then to take that information and send it in a secure manner. So that might be Google Drive. We're trying to avoid email, but potentially this could be emailing a member of staff at the NHS, and they'll receive that data. And then what we need to do is we need to scrub certain what we call geofences, which is remove things like our home and our workplace. So there's no identifiable personal data. So that's a step that we have to do. Now you can see on the left hand side we've got a model that's been generated. Now this model took roughly about 5 hours. So we had the latest build of the Android app, and this application discovered the different flows through the platform, and then it did two things. First of all, it generated over 200 automatic flows through there. So they're tests going through the history to see if someone's been exposed. So you can see there on the 22nd, no exposure as of yet, and it's extracting the date and also the color. So using Tesseract for OCR, and then image recognition technologies, image-based testing technologies to understand the color. And it's going through all those positives, false positives, and generating 200 tests of all paths through the system. Now, the other thing what it's doing is doing exploratory testing. So this is AI powered. So the guys at Eggplant AI R&D have been working to create algorithms to test all sorts of different data combinations. So that's kind of all the different types of health authorities, all the different types of languages, all the different types of data. So, you've got to go through every single one of these scenarios to give confidence, and also to provide that assurance of that we're not going to get false positives, and potentially someone's going to have to isolate for 14 days when really they've not made an interaction with somebody else. And one of the big things that was important here is that this is cross platform. So you can see here when I share my location information, I will go out off the application and I'll either go to whatever platform I'm using, Save to Drive, or Gmail. So part of it is I need to be able to go between different applications. I need to then be able to look at what it would be if I was a nurse for the NHS and I was receiving this, and I was then uploading that data to the safe locations visualization platform. So very interesting, but 5 hours, very quick, and it gave us the power to actually be able to model the different scenarios. So now really is the big call to action. I want everyone to get involved. And you may be saying, well, maybe I'm not a tester, maybe I'm not a developer. Can I still make a difference? And the answer is absolutely yes. You can email me, that's help@coronavirus.fo, and I'll send you information, chat with you, give you the links that you need to do, and see if, invite you to the different channels, and then, we can see how you can help. But everyone can help on this pandemic. So, there's kind of the big crowd, the big call for action for people who are listening, who are maybe they've got a bit of technical background or they've done something similar that might be able to help. The things that we're looking for at the moment is things like exploratory testing. So that's literally getting the mobile app, which I showed you on the phone, and going through the different sections. So, for instance, now if I look at my exposure history, I've got my data there, and by me sharing my data with my Google location data, I'm contributing. So you can just download the mobile app, share your data with it, and check yourself. So that's one big thing you can do just yourself with your own data, because you're unique. The second thing is we're looking for people who are actually going to look at different functionality and see if they can get to do that. Now we've had a huge support from a number of different vendors as well, who have offered products for free to build during this crisis. So the guys, Iran, who's a good friend of mine, from Perfecto, has offered people to be able to get onto the Perfecto platform and be able to access any device in any language in any country. And as you can see, there's a little widget there that allows you to pick Copenhagen, send the GPS locations, by manually inject those in, so you can pretend to be anywhere on the planet for that kind of functional manual testing or automated testing. We're doing performance testing. I did a session with the Performance Advisory Council yesterday, and the people who volunteer there are going to help with the performance engineering aspect. We got teams who are doing security testing, which is incredibly important because obviously it's privacy first. Location testing, so we need people everywhere. People in Brighton, people in Scotland, any place that you are would be great. But also, if you're global, it's we need multiple to check the multiple languages. We need to check the multiple different configurations and layouts on different form factors and sizes. So if you've got an old phone, even better, that's going to really help us because we got to try every device to make sure it works. So if you've got UX or you know what looks good and what doesn't look good, you can give us feedback there. So huge amounts of opportunity for us to do, for you to get involved. And like I said, sharing your data would be a huge benefit for the project. On the right hand side is a set of GPS data that I've extracted out, which we load into the redaction tool, so you can remove any personal data. So if you're concerned that you don't want to share your home address or your work address, we can remove that information and sanitize it to you and send it back. So don't worry about things like that. We're trying to be as transparent as absolutely possible, but we need your help. Now, if you don't have any the technical skills, or you don't want to you can't get involved, you don't have any time, you've got a lot of other things on, you can also donate your laptop or PC to this. So in the other session that I'd recorded for today, which I'm sure will be available on YouTube or something afterwards, I mentioned the fact about using the World Community Grid. So this is something that's close to my heart. I've donated over 22 years, so I'm about 50th in the world for donating my CPU time on my laptop. So all you need to do is install the app, and they've helped with things like they did the human genome, they cracked that, they've been fighting cancer and AIDS, and now they're turning their focus onto COVID-19. So, I've put links in there, so you can just type that in and go straight on there. So that's one option you can do. The other options is obviously you can get involved. So I've added the links, which I know is probably not the clearest in the world, but we've got the safepaths.mit.edu, which is the MIT project. If you're technical, you've got the Git repository there, so you can go straight into the code. You've got links to join the project. You've got technical documentation. The second one would be the COVID Safe Paths. So that's where the charity, which has been set up, it's a non-for-profit. We're all volunteers here. We're all helping. And that will tell you a little bit more about the actual project. And then what I've done to shorten this down, to make it a bit easier, is I've done a Slack channel link, which is a link to go in and talk to other volunteers. And then the Google Docs application form. So that's the official sign up as a volunteer and register as a volunteer. But there is a backlog of people getting through that, so you might be easier to go straight to the COVID Slack channel. We've got a WhatsApp group. Like I said, if you email me at help@coronavirus.fo, then I will also I can send you this information on. So I'd like to thank everybody who's attended this session, who wants to help and make a difference now. And this is our opportunity to come together and make a real difference. And as a bit of fun, I put in there a picture there, which is obviously the Elon Musk. Social distancing, maybe that's a bit far, but practice social distancing, stay at home, stay safe, and help the community and become a digital citizen, and really let's work together to help the world.